So, very good morning. In line with our last session, today we are going to be talk regarding cynotic and cynotic heart disease. Basically, this belongs with the cardiac system. So, cynotic heart disease and acynotic heart disease. Acynotic heart diseases are the diseases where the left to right shunt is present. Means the blood flow from left side to the right side. In left side, generally there is a oxygenated blood is present, and now the oxygenated blood is going to be flow into the right side, that is an deoxygenated blood. Means we can say oxygenated blood is going to be mixed with the deoxygenated blood. So this will present into the acyanotic heart disease, while into the cyanotic heart disease the term itself is telling very clearly cynotic means there is a bluish discoloration of the skin will be present, there will be the clubbing of the finger will be present, clubbing of the nails will be present. So this is the condition where the shunt of the blood flow will be from right side to the left side. Means deoxygenated blood is going to be mixed with the oxygenated blood. So in acyanotic heart disease, basically there are three diseases which is most common, that is VSD, ventricular septal defect, ASD, atrial septal defect, and PDA, patent ductus arteriosus. So the most common disease which is 8 to 10% is present among the children, that is a ventricular septal defect, and then atrial septal defect, and then patent ductus arteriosus. Patent ductus arteriosus is a condition where there is an abnormal connection, or we can say there is an connection between the aorta and pulmonary artery. So due to that, patent ductus arteriosus is present. Now basically we need to learn here about the cynotic heart disease. In cynotic heart disease, there are two important diseases. One is a tetralogy of Fallot and another is a transposition of great arteries. Today we are going to be discuss about the tetralogy of Fallot, or it's also known as a Fallot's tetralogy. As the term itself is very clear, tetralogy means there will be the four abnormal condition which is present in this particular disease. So what are the four main conditions which is present? One is a ventricular septal defect, next is right ventricular hypertrophy, next is overriding of the aorta, and then fourth is a pulmonary stenosis. So these four conditions are very common present into tetralogy of Fallot. Now we will move to the next. What are the this is again present for 5 to 5% among the children it is present. Now what are the basic clinical symptoms which is present into the children? The most significant sign is the cynosis. As we said, the term itself is considered as a cynotic heart disease, so it's a cynosis. And the next is clubbing of the finger and toes. Then there is a squatting position, tet spells are present, the growth and development of a child is very delayed, then failure to gain the weight, child is not able to get an appropriate weight, poor development will be present, the feeding difficulty will be present. So these all are the common symptoms which is present. The most important, that is a boot shape heart. The shape of heart is become like a boot because there are four abnormalities are present. So due to that, the heart's shapes is become changed. And the most important is there is a presence of bluish discoloration into the body, especially into the nails, into the lips. This is now what are the diagnostic evaluation? Firstly, we'll go with the physical examination, then we can go with the cardiac examination, then we can go with the echocardiography, and then we can go with the cardiac catheterization. Through this whole diagnostic investigation, we can find it out what is the exact problem which is present into the children. Now what are the therapeutic management we can do, whatever the medicine we can provide to such type of children. So first is propranolol, that is one drug that we can introduce, and then intravascular prostaglandin E1, which is a therapy. Through this therapy we can increase the pulmonary blood flow and improving the arterial blood oxygen. There are some surgical management is also present. One is a palliative surgery, another is a corrective surgery. So we'll see. One is known as a Blalock Tussing shunt, Blalock, BLALOCK, Blalock hunting shunt, then Watterson shunt, then box procedure. So these all are the things through which they are going to be close the ventricular septal defect. Firstly, they are going to be close the ventricular septal defect. Once the ventricular septal defect is become closed, so the blood will not move from the left side to the from the right side to the left side, and ultimately it is going to be closed.